Hello and welcome to the autobiography of Thaizide-like Diuretics. You are going to know about my generic names, which are chlorthalidone and indapamide. My brand names and chemical name are Hygrotron, Thalitone, Natrelix SR, and Lozol. For my drug classifications, my therapeutic classification is thiazide-like diuretic, and for my pharmacologic classification is low-ceiling sulfonamide diuretics. I belong to pregnancy risk category B. Now for my mechanism of action, I act mainly on the nephron and I inhibit the reabsorption of sodium and chloride ions from the distal convoluted tubules of the kidney by blocking the thiazide-sensitive sodium chloride symporter. This causes increased fluid loss to urine that leads to decreased extracellular fluid and plasma volume, and this depletion of volume results to decreased venous return, increased renin release, and reduced cardiac output and blood pressure. Now for my pharmacokinetics. I am rapidly absorbed in the GI tract, and for my distribution, as for indapamide, I am widely distributed into the body tissues, 71 to 79% bounded to plasma proteins. As for chlorthalidone, I am extensively distributed in erythrocytes with 75% bounded to plasma proteins and 58% to albumin. I am highly metabolized in the liver. For my excretion, I am eliminated in the urine. Now, for whom am I indicated to? I am used for the treatment of hypertension, particularly in mild and moderate cases of hypertension. For whom am I contraindicated to? I am contraindicated with patients with severe renal failure, anuria, allergies to loop diuretics, and hypotension. Also, patients who have gout, allergy to sulfa drugs, and hypokalemia.
Side and adverse effects. Thiazide and thiazide-like diuretics may cause side and adverse effects in our body systems, such as in central nervous system, dizziness and lightheadedness, weakness and headache. For cardiovascular, hypotension and arrhythmias. In GI upset and loss of appetite. In GU, hypokalemia or can precipitate hyperglycemia, and hypercalcemia and hyperuremia or slightly alkalinized urine can lead to bladder infections. Also, it may cause sexual dysfunction. Our nursing responsibilities. Before, obtain a complete health history including data on recent surgeries or trauma. Obtain patients' vital signs for baseline data. Obtain clients' medication history including alcohol and nicotine consumption and use of herbal supplements to determine possible drug allergies or interactions. Obtain blood and urine specimens for laboratory analysis. For chlorthalidone, inform patient of side effects such as dizziness. Advise patient not to drive or operate machineries during treatment. Also tell patient to avoid long-term sun exposure. For indapamide, as this medicine may cause photosensitivity reactions, advise patient to avoid long exposure to sunlight and UV light. During, indapamide may be taken with or without food, while chlorthalidone should be taken with food. For indapamide, initially 2.5 mg once a day, may increase to 5 mg daily after 1 week if necessary. For chlorthalidone, for adult, initially 12.5 or 25 mg daily, given alone or with other antihypertensive. It may increase to 50 mg daily if necessary. Monitor changes in patients' vital signs, especially blood pressure. Monitor laboratory values as diuretics can cause electrolyte imbalances. Observe patient for signs of hypersensitivity reactions and changes in level of consciousness, dizziness, fatigue, and hypotension. Monitor patients' hearing and vision as thiazide diuretics increase serum digoxin levels. Monitor patients' reactivity to light exposure. And after, evaluate effectiveness of drug therapy based on the results of the treatments and significant changes from the gathered baseline and new data.